All right, I'm gonna sanitize my hands here. Hi, my name's Christina Rand. I'm a nurse practitioner student with Saginaw Valley State University, and I'm gonna do an abdominal assessment on you if that's okay.
Sure.
Okay, so I'm just gonna try and maintain adequate draping. So I am gonna have you lift your shirt up here.
Okay.
Okay. All right, so while I do that, I have a good look at the abdomen. And while I'm inspecting the abdomen, right now I'm looking for abdominal symmetry, which it is symmetric. I'm also looking at the skin. And I do note a scar that's midline here, about from the xiphoid process to the umbilicus. The umbilicus is inverted. There's no drainage, no lesions or anything noted on the skin or the umbilicus. I'm also looking for peristalsis, and I don't know any obvious peristalsis right now. I do know some aortic pulsations though, which is normal. So next I am gonna move on to auscultation. So I am gonna listen in all 4 quadrants here, and I'm listening for vowel sounds, and they are present. And I don't hear any like tinkling or high-pitched noises or anything like that. They are active, and next I'm gonna listen for abdominal bruits, and I can use the diaphragm or the bell of my stethoscope, and I'm gonna go halfway up from the xiphoid to the umbilicus. I'm gonna listen to the aorta, listening for any bruits, and then 2 inches to the left and the right, I'm listening to the renal arteries. Again, assessing for any bruits, none noted. And then I'm gonna go down to the umbilicus, to the left and the right, listening to the iliac arteries here, and no bruits. And then as well as the femoral arteries. And again, no bruits or abnormal sounds noted. So then next I am going to listen for a splenic rub as well as liver. So I'm going to do that by having my patient take a big deep breath and listening to the spleen. So take a deep breath and out. Okay. And as well as liver, big deep breath and out. Okay. And I don't hear any scratching sounds or anything like that that would indicate any enlargement of either of those. So next I am going to move to percussion, and I am going to percuss all 9 quadrants here, noting the tympany over the splenic area and the dullness over the liver. Okay, and next I'm gonna measure the liver by percussing here, and so I'm starting to hear dullness about right here, and then I'm gonna go mid-clavicular line as well, and I'm gonna start low, and I hear dullness here as well. So that would be measuring for liver size there. And then next you can do the same to assess the spleen. So I would have my patient take a deep breath, and I would move anterior axillary line and percuss. Okay, and no signs of really any dullness or anything like that on percussion. Moving on to palpation, I'm going to start with some light pressure in all 9 quadrants here. Oh, I'm going to have you lift your legs up. Thank you. Okay. And again, I'm asking if the patient's having any pain. I'm feeling for any kind of masses.
No pain.
Nothing. Okay, next I'm going to do a deeper palpation. And I'm being sure not to pick up my hand too much when I'm doing this, so I don't miss any masses. Again, any pain?
Nope.
Okay. And again, I don't feel any masses or anything like that, or any nodules. Then moving on, I am gonna assess the liver. So I'm gonna use the hooking technique. So I am gonna hook just below the rib cage here. And then you can also take a deep breath too. Okay, and exhale. Okay, so I feel good lineated margins of the liver here. And I don't feel any nodules or anything like that. Or any hard masses that would make me think cholecystitis or anything like that. And then I am also gonna feel I'm gonna palpate, for your spleen. So I'm gonna apply a little bit of pressure here below this, the left ribs here, and press up and feel for any splenic enlargement underneath the rib cage, and I do not. Moving on, I can assess for any kind of peritonitis by doing rebound tenderness. So I'm gonna press my hand and then move it away briskly. Are you having any pain with that?
No.
No pain. Okay. So then I can also assess Murphy's point, and that would be for cholecystitis in the right upper quadrant. So I'm gonna have you take a deep breath, and I'm gonna, okay, and then I'm gonna press in the right upper quadrant, and then you can let it out. And I'm assessing for any kind of like sharp pain or the patient guarding, anything like that. Next, I'm going to assess for appendicitis, and that will be in the right lower quadrant. So I can assess for Rothsing's sign by pressing on the left lower quadrant and asking my patient if you're having any tenderness in your right lower quadrant. Are you?
No.
No. Okay, so then next I can also do psoas sign, and so I'm going to have my patient extend up her right knee, and then I can also have her push up against me. And are you having any pain in the right lower quadrant? No pain.
No.
Okay, so then I can also do obturator sign, which my patient's hip would be kind of flex and extend, but she's had some extensive hip surgery, so we're not going to do that. Then I can also
I can try and do that.
That's okay. We'll try. That's fine.
Okay.
So next I would also assess if this patient had any ascites. I would have her move onto her left side here.
Okay.
Okay. And then the ascites is dependent, so it would fall down to her left or whichever side she's laying on, and I would percuss along that side, and it should be dollar versus tympanic, which would be up here. And then I am going to help you sit up here, okay? So
sure.
if you need some help.
Yep, I did.
All
Thank
right.
you.
So I'm going to assess for costovertebral angle tenderness. So just below the rib cage here, this angle. I am going to place my hand back here. And are you having any pain with that?
No.
Any pain?
No.
Okay, no. So we're looking at the kidneys and if they're inflamed or having any pain. So thank you for your time, and we are all set.